Hello, my name is Dr. Mitalee Thakkar, and today, July 23rd, is known as the Sjogren Syndrome Awareness Day. So, what is Sjogren syndrome? It is a rare chronic autoimmune disorder that mainly affects the moisture producing glands of the body, and it leads to dry mouth, dry eyes, chronic fatigue, and muscle pain. It mainly affects women above the age of 40. Now, there is one more syndrome with a similar name, which is known as the Sjogren Larsen syndrome, and it mainly affects children. So, what is Sjogren Larsen syndrome or SLS? SLS is a rare genetic condition, also known as a neurocutaneous disorder, because it mainly affects the skin and nervous system of the child. And how does SLS present itself? So, SLS is caused due to mutation of the gene ALDH3A2 gene, which causes deficiency in the enzymes which are important in breaking down fats in the body. This leads to fat accumulation in the skin and brain of the child, causing SLS. SLS is mainly seen in early infancy or right after birth. And what are the first symptoms that you see in SLS? So, SLS begins with something known as ichthyosis or dry and scaly skin. And then, as the syndrome progresses, it can lead to muscle pain, fatigue, spasticity, difficulty in walking and achieving other developmental milestones, as well as vision problems, behavioral problems, and sometimes seizures. So, how does pediatric physiotherapy help in SLS? Pediatric physiotherapy mainly helps in managing these symptoms. It helps in managing spasticity, strengthening the muscles, especially the respiratory muscles, and it helps the child in achieving their milestones. It also helps the child to function better in their ADLs or activities of daily living. Physiotherapists can also provide visual rehabilitation, a part of behavioral therapy as well. But SLS requires a multidisciplinary approach and early referrals. So, a multidisciplinary team of neurologists, speech and language pathologists, physiotherapists, occupational therapists, genetic counselors, as well as special educators are essential or key factors in managing SLS. So, today, on the day of Sjogren Syndrome Awareness Day, we would like to emphasize this rare genetic disorder, which is known as SLS. And we would also like to emphasize the importance of a multidisciplinary team, early referrals, and early intervention therapy in managing symptoms of SLS and helping the child lead a better life. Thank you.